So Sue asked me to look at the issues of postnatal care, because I think one of the concerns that a lot of us have is how postnatal care, it's always been called the Cinderella service. I trained in 1982, and I have to say, even as a student and then even as a community midwife, it was always seen as the Cinderella service. It was always the service when people needed help, they pulled from the postnatal ward or community as well. And I just think we have to try and refocus on what we want. It's been talked about already this morning, hasn't it, about transformation services and what women want, and one of the things that came up was definitely high quality postnatal care and obviously breastfeeding support. So I've tried to put together some slides. I was trying to be clever. I'm not always clever, but I thought I'd try, and use the Cinderella analogy to try and describe what is already happening around the country, because I asked colleagues what they're trying to do about postnatal care, and perhaps some of this might be challenging. I think we're quite precious and rightly so proud of the postnatal care we offer in the UK, albeit perhaps not as good quality as we'd like. And I know that from colleagues who work in other countries who have very little postnatal care. You have your baby, you go home, and you might get one visit back at the clinic, 6 weeks, 2 weeks later. So I think rightly so we should be proud, and we need to hang on to that, but I think maybe we actually need to re-look at how we're actually providing postnatal care. To give you another idea, because I know some of you are either fairly newly qualified and or students, and I heard someone just saying students to be. When I was a community midwife, we used to do 2 visits a day for the first 3 days, and then every day, minimum 10 days, and sometimes much longer, 14, 15, 21 days was not uncommon. Now, I am an old girl, okay, but I think we have to bear in mind things have changed. And I tried to list what, for me, in my career has changed that has had such an impact on how we provide a quality postnatal service. Certainly looking at NICE guidelines, CQC guidelines. I'm a CQC inspector as well. There's very little tangible evidence about the quality of what we offer. So what has changed? Well, from the community point of view, I think the amount of screening that the community midwives now have to actually engage with, and the amount of information, rightly so, they have to get across to women. And if we're taking that information to the women, then it does mean that there's going to be less time for postnatal care. We have to mention staffing levels. It was mentioned first thing this morning. It varies which paper you read, but we are certainly understaffed on the numbers of births that we have. The birth rate has gone up tremendously, certainly where I work in Kent. You can tell by the accent, I'm not from around here. It has gone phenomenally through the roof with the birth rate, and staffing hasn't kept up with that by any stretch of the imagination. We have, in many units, got rid of nursery nurses. Where I used to work, we had fantastic nursery nurses. It went out of fashion. Many of them were sacked, resigned, and left the service totally. MSWs have changed their roles dramatically, as have midwives. When I started midwifery, we didn't suture, we didn't cannulate, we didn't do an awful lot of what we now do and take as given. Certainly never did NIPEs, and I know that's now coming into student training. There is reduced commissioning. We don't get as much money now, and many units will only get paid for one visit when the woman goes home, and they visit then perhaps on day 5 or 6 to do the newborn heel prick. The diversity of the women has changed, I think, beyond any recognition of what it was like when I trained. Beyond anything. The diversity, the complexity of the women we now care for. And that has all had a huge impact. And that's why I still think we're still called the Cinderella service. So, it may challenge you. Please feel free, if there's time at the end, to ask me what I think. So I want to be your fairy godmother. I have my wand, okay? That's anyone who saw me getting it out earlier. How can we make our dreams as midwives come true? Because that's what we need to do. I think we need to look at what we're doing. How can we do it more creatively? And much of this is already happening in the UK. Some might be new ideas to you. The pumpkin becomes the carriage. We all know that. We all know the Cinderella story, hopefully. but changing how we actually provide the carriage of those services. So thinking about postnatal hubs, I have to stress, I know some of this is already happening. Looking at the shops, just walking around Birmingham yesterday, the amount of empty shops. Why aren't we utilising where women are going? What day is market day? What day do they come in to do their shopping? Can we not look at using some of these empty resources? What about the library? Where I live, in quite a small village, the centre of our area, we used to have a pub, but that's closed now, but it's a library. It's where women go, they meet, they chat, they have a play group. So why can't we use some of these resources areas to actually have our postnatal hubs? Creches, already being used, and religious centres, and that's why I said about the diversity of the women that we now care for. Where do women meet as a group of women where we can actually provide that postnatal hub? Postnatal hubs perhaps on the move. There are several units around the country who are maybe somewhat more remote who have postnatal buses. A bit like if you go and have your breast screening. There's a little bus and there's lots of information in it, and at the back they have a small couch area. So if the woman needs a physical exam, they have somewhere private to do that. And this flows around the areas. Some of the more rural areas are already doing this. Did you know that? Because I didn't till I asked. And then social enterprise scheme. We've obviously got some of the private midwives having a stall out there, but I think we just need to be more creative and stop being so precious, perhaps to some extent, about how we're providing that postnatal care. So social enterprise groups, support groups, you name it, and there's probably a support group out there for the women we care for. So why don't we interact more with them? And many places have started to do that. Sadly, many of us have not. So here's our mice. They're going to become the horses leading the midwives to new places. MSWs I've already said about. Their role has changed dramatically, whether you call them healthcare workers or MSWs. Many are band 3s, some are even up to band 4s now. So I asked the midwives and the MSWs that I work with, what could we give to you, skilled, trained, to be able to do it, that would help the midwives with their postnatal care? Data input. How long do you spend sitting on a computer having to input data? Hours. And if you're old like me, even longer, because I have to sit there and read the question, think, hang on. Always a drop-down menu. Okay. And the midwives, the younger ones next door, and they've done 4 and I'm still doing 1. So why do we feel we have to spend so long inputting data? There's the nursery nurses. I think they're a lost opportunity. They can support so well, and some places do it well, with transitional care babies. But they were such an asset to us with breastfeeding support. So, why don't we look at reintroducing? There are many potential midwives that just don't get to the academic level to be able to get them into a university. So why aren't we looking at re-skilling some of these people to be able to provide good quality nursery care? And again, some places it's already happening. There's Bruno, the faithful bloodhound. He becomes our coachman. He helps maybe with nurses, and this might be one that people find uncomfortable. In most units in the UK, the average caesarean section rate is 25%. Do we need a midwife providing care to basically a woman who's had a surgical intervention? It's called caesarean. What is the only difference? And again, I did ask colleagues, what's the only difference with a routine postnatal check, which is still sadly in many places just a tick list, for a woman who's had a caesarean section compared to a woman who's had a vaginal birth? There's only one thing that I think, and many midwives don't even do that now, that we do differently. We do observations, we ask her about her general health, nutrition, how she's feeding. There's only one thing that I think we do differently, vaginal versus caesarean. Palpate the uterus, and there are many midwives who don't palpate uteruses on vaginal births anymore. Won't get into that argument, that's a whole different discussion. So why is it that we are caring for women who need good quality post-operative care. We hear about women post-operatively getting pressure sores. I was mortified when I started to read some of this information. Why? Because we haven't got the time. Women are more complex. They may not have had that opportunity to realise how important it is to move. The signs and symptoms of early signs of sepsis, it's such a big issue. Is it appropriate? Is it necessary for midwives necessarily to provide that information? And this is already happening in the UK. Think about your section rates. There's Major, the horse. He becomes our fantastic ward clerks and clerical staff. I'm sure, like where I work, there are so many fantastic ward staff around. So they can help us steer through the complexity of some of the paperwork and the referrals. Again, I ask them, the clerical staff where I work, what is it that you see the midwife sitting doing on a busy postnatal ward, let alone in the community, that maybe you could actually take away, having the right skills, training, and backup support for them. And that includes good IT systems. Someone was just mentioning that in another session. So let's reevaluate what we're actually doing with our postnatal care and who can assist us so we can do what we're fundamentally meant to do, to support good quality, high quality postnatal care for the women under our care. And the final one, it is a short session because originally this was a taster, so it is only short because I'd like you to ask some questions if you would. Lucifer, the cat. So who is Lucifer? We've talked a lot today already from people I've heard about multidisciplinary working. So utilising those skills in appropriate places. Sometimes you hear people say, oh, well, the doctors come round and they still do a ward round and they go and see every C-section woman. Well, is that good utilisation of their care? Maybe not. So let's hang on to those high quality professionals, the obstetricians, the paediatricians, and please don't forget our GPs. In many environments, the GPs have been pushed out because care has been moved from the GP practices. When I was a community midwife, we had fantastic relationships, oh that sounds bad, professional relationships please, with our GPs. They knew the women, we knew the women. And the handover was very, very sleek because it was a continuum of care. We were just handing over from one professional to the other. So I hope it might have given you some ideas from going from what we've always called the Cinderella service to moving to that princess service, which is where I think we should be very proud that we can get back to, but we have to be creative. That's all I want to say. Thank you very much. Swap hats. Any questions at all? Oh, there's a mic going. We got any? Anyone got any questions? Or challenges, please do. I love being challenged. No? Is any of this already going on where you work? Or is it still seen as very traditional Cinderella service? So no one's doing any of this? Oh, they are, thank you. No, go on, please. Just wait, because they'd like to. Thank you.
Hello. I was going to say the opposite, actually. Really sadly, I couldn't have got through having my two children without our library, and but it's all being closed.
Right.
The health visitor doesn't even do clinics anymore. She's pushed out to another village, because I live in a village, so now there's people who don't drive. Everything was a walk away. The breastfeeding support groups, the rhyme time, the under one group, all of that, and it's gone. Yeah. It's all gone. Yeah. It's really sad.
Yeah, and that's why I think, we need to look at, getting baby friendly is really, really hard. And I think that's because women are not getting the antenatal support and they're certainly not getting the postnatal support. Please do.
They did all, yeah, our community midwife left to work in the hospital in the labour ward, and the next community midwife didn't carry on the antenatal classes, so now we don't have those either.
Right.
So I feel very lucky that I had my babies when I did.
Yeah. I just feel we've taken on so many other skills and not really gone back to basics. And certainly what they were talking about, in the NMC, if you have interacted with their table, talking about looking at what we fundamentally do well, but how can we do it within a good competency issue? And I think we're losing sight of postnatal care, quite sadly. Thank you. Were you going to?
I was going to say, actually, I'm in Nottinghamshire, And our services, we were having this conversation earlier, are very good. We still have a lot of the feeding cafes. Both the hospitals run a feeding cafe. The feeding cafes are drop-in clinic for tongue tie, so they will diagnose tongue tie there. You don't need an appointment. Your midwife can sort of give you the information of where to go. And I felt through I've had 4 children. I've had 2 singletons and a twin pregnancy, and I have felt that the consistency of care has been very, very good within the PCT. Even I delivered at 2 different hospitals, and even through those 2 hospitals, it seemed to be very consistent. It was the same consistent message.
So they're doing something right, and that needs to be shared, I think. You know, that's one of the things I know Sue said this morning. You know, talk to 2 people you've never met before, and that's the sort of thing we can be sharing. So thanks, that's really great. Anybody else want to challenge? Oh, thank you.
I'm a community midwife with my colleague here, and our area, we work in Dudley, and I think our women are quite fortunate because we do have quite good continuity of care, and the women we see antenatally, we'll see them postnatally as well, and we do home visits. And I just wanted to say, I think the idea of the hubs and drop-ins are brilliant for some of those women to access. And we did sort of try to trial that earlier, well, it was going to be last year, wasn't it, which didn't actually happen. And I think it's really important that we do still see women in their own homes, because I think you learn a lot more about the woman and her situation in the home, and I think that's really important. I think that would be really sad if we lost that.
I agree. So, and I have to say, you know, and that's what I said, you can tell by my accent, I don't come from up here, but London and the South East have the highest rate of vacancies anywhere in the country. You go further north, we go to Edinburgh in November, I think it is. It's a totally different package. It really is a north-south, east-west type division, and that's not equitable for our women at all. So thanks for sharing how well you're doing, and well done for doing that. It's fantastic. Anyone else want to share any great experiences, opportunities, challenges? The students who are here, how are you seeing postnatal care? Are you seeing continuity? Are you seeing those opportunities? Don't be shy. We're all here together. No, they don't want to say. Well, our students certainly say they're really saddened about the postnatal care. They said, you know, they spend so much time now having to, with the community midwife, spend so much time on screening information, you know, the complexity of the women. You know, we know it's changed dramatically, but I just think we need to look, and that's about asking each other, what can we actually do to improve the service? And that's where some of these things have come from, just asking each other and sharing thank you and learning from each other. Oh, thank you.
I was at a session yesterday looking at breastfeeding and maternal mental health. And one of the things they said which really surprised me was that there's 2 studies looking at the impact of the UNICEF initiatives in hospital, and both of them actually show that where it's well implemented, maternal mental health is worse because of the pressures that goes with breastfeeding. And I just wondered if anybody else had any other thoughts about that.
And I think social media, whether it's good or bad and you love it or hate it, when they kept putting up about tweeting, I was laughing and saying, yeah, okay, tweet. That's about as far as I go. But there is huge pressure, isn't there, on social media as well, with women almost being bullied about whether or not the care, the type of birth they've had, whether or not they've been successful, however you want to phrase that, with breastfeeding. And that's the complexity that has changed so dramatically. Yeah. Oh, good. Final one, and then I'm sure I must be coming up to time.
Yeah, I just wanted to back up what that lady there just said, because I went and spent some time at a postnatal depression group, and they said that the main thing that the women go in there and present that is causing them major anxiety is actually the pressure to breastfeed. Yeah. Which is a shame, isn't it, that they feel that way?
It is. Yeah, I mean, the world has changed, and I think we just have to change with it. I'll accept I don't tweet. I do Facebook, but I don't tweet. But yeah, I think we just have to try and be realistic. But where services are working, share them. One of the things, you know, through this organisation, we try so hard, and when you're working in it, you don't always realise how good that service is. So share it. We have awards. We love to hear for the awards where the services are working well and why. So never undervalue what you're doing. It's very important, and share that and where the rest of us can learn. So thank you very much. Swap hats time now.